Hello and welcome to the youth group of the EPF's meeting on sexual health and well-being. I see people are still coming in. The topic is, or the aim is to discuss sexual stigma and be provocative. And I'm very excited for this. I hope everyone is coming in now. I'm Irene Schokker. I'm part of the EPF Youth Group, and I will moderate this event today. We are having a panel discussion with beautiful people here that are great experts on this topic. And maybe we can already go to the next slide. Okay, before we start with the panel discussion, we're going to have a small introduction about who the youth group is, some housekeeping, as you can see, and what we've already done on the project. So for the housekeeping rules, first of all, I want to mention that a trigger warning, as we're going to talk about sexual content. I want you all to be safe and take care of yourself. And be respectful to others. While you're not speaking, please mute yourself. And we have a discussion box where you can ask questions. And we still have our one panelist who is not able to speak yet. But yeah, feel free to write all your questions in the chat. And if you like, you can also ask them publicly later. The meeting will be recorded, so be aware of that, and I hope you all agree with that. And then the statements or topics we're going to be discussing don't necessarily reflect the youth group's opinion. We just want to encourage critical thinking and radical empathy. So on the next slide, Anastasia. Oh.
Hello. Yep, so my name is Anastasia Seaman. I am the president of the EPF Youth Group, so the organizers, creators, and presenters of today's event. Just one additional housekeeping before I get into who we are is that you've all consented to photos to be taken, so as well as this will be a recorded event. We'll also take some pictures, so hopefully we can all come back and remember this experience for the future. So yeah, if you have any issues about that, please just message us. So a little bit about who we are. So we are the European Patients Forum Youth Group, and we ultimately represent the perspectives of young patients on a European level. We all come from patient organizations, and together we brainstorm, develop, and fulfill projects that we believe encompasses areas where the young patient voice is either often missing or where there are current stigmas or gaps that we believe need to be addressed. We have investigated in the past topics around inequalities in the workplace, inequalities faced by young patients, the importance of youth groups in hearing the young patient voice. And today, as Marlene so very well said, we're here to discuss and round up our topic on the stigmas around the sexual health and well-being of young patients. We recognize that this has been and is still viewed as a very quote unquote taboo topic, but without these discussions taking place and taking the time to break down these stigmas, then everything is really only going to remain taboo. So let us begin. Any questions you have, please feel free to message them. And throughout this roundtable, we're going to take the time to address these different points of views and questions and comments and just have an open space for it. So yeah, we hope that you enjoy it, and let us begin.
Next slide, yeah. So we have been spending quite some time on the topic sexual health and well-being. To start the project, we conducted a survey among young patients to see what are issues that they would like us to talk about, and also the channels they would like us to use for that. From the survey, then we developed a strategy, and we brought out a article on sexual health and well-being with Moira Tzitzika, I'm so sorry for mispronouncing it, who is also here today and will be one of our panelists. Then Bianca and Cornelia, two of our youth group members, were recording an episode on the EPF podcast. Then we also had STIPA, the summer training for young patient advocates, which also focused on sexual health and well-being. And during our last in-person meeting, we were able to record videos of telling stories of other people who submitted anonymously stories about their sexual experiences. You can find these on YouTube. And yeah, this event, like I said, will be to finalize this project. And then we can come to our panelists. We have Irene Schokker from Linschoten. Maybe you can turn on your camera. She is a nurse practitioner at the Erasmus MS Sophia Kinderziekenhuis Hospital in the Netherlands. And she has a diploma in sexology and a master's in nursing. Then we have Moira Tzitzika, who I mentioned was already in our article. She is a psychologist and certified psychosexologist with the European Society of Sexual Medicine, and her special interests in research are chronic diseases and disability. And then our last panelist is Konstantina Wumaki, who is one of our youth group members. She is a medical student, a patient advocate, and yeah, we're very happy for her to also join this panel. Then, yeah, we can come to the first discussion. Please feel free, if you have any statements, questions, submit them in the chat box or raise your hand. The first topic of discussion is some patients should not have children. Dear panelists, please unmute and let's see what your points are on this.
Hi, everyone. On this evening, sorry, take a couple of minutes to come in for this, but thank you for the invitation to talk here. I think it's a very, very good topic you are busy with, because there has to be more attention for this topic. So I'm very glad that you are doing that. And I hope we will continue with this. As for this discussion point, I think everyone has his own feeling about this. It's a very large question with a large answer, I think, because it's not one thing you can say, I have children, or I want children, or I don't want children. And I think for every people, you have to make your own decision, and medical, but also friends and parents can help you with discussion. But if you want children, then you always can see what are the possibilities to have it. And I think the most important thing here is that you can talk about it. And if you talk about it, your view will be better, I think.
My thought in this is that I am a patient, but I'm a medical student too. So I have two perspectives. And the first thing to think about is if it affects the baby, the health of the baby or the mother. And if not, then it's their own choice. And sometimes it might need a supportive system around them. Some days might be hard in some diseases that they might need a supportive system for the baby. But this can be in the face of the partner or their parents or whoever. And if they have the supportive system, then it's their own choice.
Can I speak?
Yes, please.
Okay, hello to everybody. I'm glad to be here with you again. Let me give you my point of view as a sexologist on the subject of someone when having a chronic disease and want to have a baby. We must think of three things. Is the disease hereditary? That is, will it pass to the child? Konstantina said it already. And in this case, it is advisable for the couple to visit a specialist to see the risks, to count the risk and weigh the risk of having a healthy baby or not. And afterwards, we have to think about how do drugs for the treatment of the disease interfere with fertility? Or is there a contradiction with pregnancy while taking the medications? And the third thing that comes to my mind is that can the individual or the couple bear the burden of caring for a child? Is there a supportive network to help? Because Konstantina said it also already, and thank you very much, Konstantina, for saying these things, that some days are hard and some days are easier. What happens when someone wants to have a child and she or he cannot bear the burden of having a child? Because most of us, when it comes to talk about pregnancies, we think that, okay, life is going to be easy. Okay, of course, everyone should have children if they want to. But what happens when life is not like, how can I say, everything is pink and with bubbles and so on. Getting pregnant with a chronic disease is possible for women. And of course, it's possible for men when having their medication. But planning around is nothing like we think about it. Because, okay, what happens during pregnancy? We know that in most cases, in most diseases, our body does a great job taking care of our baby, okay, during pregnancy. But if we have a chronic health condition, it may need some extra help for our healthcare providers to manage our condition, our treatment, and of course, what's happening during pregnancy. Okay, we should think about them. All of these aspects we should be taking into consideration. Okay, because when most of us think about parenting, we imagine being active participants throughout our children's life, and we envision chasing after our toddler at the park, attending high schools, sporting events, hosting yearly birthday parties. We picture our family dinners, bike rides, vacations to new places. What we don't foresee is the difficulty of parenting when coping with the fatigue, the pain, the medication, the hospitalizations, when we have a chronic illness. From my point of view, it's not very easy, but it's achievable. Because when we have a chronic condition like diabetes or cancer or multiple sclerosis, cerebral palsy, we can do whatever we want, but we need some assistance. Am I right about that? I don't know what the other panelists are thinking.
Yeah, maybe we can continue with a follow-up question. Do you think at a certain risk or for specific diseases, healthcare providers should try to talk people out of having children?
No, no. That's not what I was saying. I think that most of healthcare providers should talk with their patients about the risks, but also about their abilities of having children. Because everyone deserves, if he or she wants to have a family or wants to be a mom or a dad, then they have the opportunity to do that, but they should know the risks also. Because there are risks in some cases, huh?
And yes, I agree with that.
I think it's important that not a disease is the topic. It's every person has his own network and his own disease and his own feelings. So this is not, you have this disease, so you don't have children. It's per person is different. So you have to see it as one person.
The patient should know all the possibilities and all the risks, all the things that they might struggle during pregnancy or after, and it's their own choice afterwards.
Exactly. Yeah. I think that we all agree to that.
Yeah, we do.
Okay.
And it's a very personal choice. So we are as a healthcare provider, we have to help you with this discussion, and we can advise and give a lot of information, but the choice is always for the patient.
Maybe, Konstantina, if you feel okay with it, you could share questions you might have in a situation like this.
As a patient?
As a patient, yes.
Well, I have diabetes, so it's very difficult during pregnancy. And my question should be if I would be healthy during pregnancy, or if I have a hypoglycemia or a hyperglycemia, if it affects the baby. That's the first questions that come in my mind. And if one time I might be hypo or hyper, if that one time might be critical for the baby. That's my thoughts.
And would you feel comfortable sharing that and also other questions with healthcare providers?
Yes, I think it's very critical to share them with, because I wouldn't be able to get pregnant if I didn't have the answers to these questions. Otherwise, I think in my disease, I can get pregnant if I don't talk with my healthcare provider. It's a difficult pregnancy, and it's 9 months, and it's very critical for the baby, my blood glucose. So I definitely should be alongside him, not him, like my doctor, during my whole pregnancy.
Mm-hmm. Then maybe we can go to the next topic. It's hard to talk about sex. Maybe you can all talk from your perspective about the difficulties to talk about sex with patients, with healthcare providers, with other patients. Yeah, anyone wants to start?
I can start.
Yeah.
As a patient perspective, no one talks about it with their partner, but everyone expects the other person to know. So sometimes people might think it's a hard job, for the partner might think that it's a very hard job for them, or it will affect them somehow. So the patients, because of these experiences, are afraid to open the discussion with their partner. And I think there is a taboo in both parts that needs to be more open to the discussions. And if the patient themselves open the discussion, then the partner would know that it will not affect them. So, and if the partner open the discussion with their questions, then the patient will give the answers they want.
Thank you.
I interpreted this question more to talk to the doctor about sexuality. So I had a little bit of another vision, but I like your vision. But I interpreted it like it's hard to talk about sex also to your healthcare provider. I don't know if that's also okay for you. But I think, yeah.
Yeah, sorry, I was, yeah, so for the healthcare provider, sometimes they don't understand the conversation. And some people, in my experience, though, I live in Greece. So in Greece, they might not even know the answers to these questions. And these make the patient feel uncomfortable to discuss it. And there are many things that the patient might have in questions about some drugs they might have, and it might affect their libido, or they might affect their mood or the mood swing, I don't know. And they can't ask their doctor because they don't feel safe to share with them these questions. And I think doctors should be more knowledgeable for these things. So if the patients, and they should start the conversation. I think it's very important, the patient to know what to ask and the doctor what to answer.
Yeah.
Well, I live also in Greece and I work in Greece, and I know that unfortunately, healthcare providers here in our country, and not only Konstantina, this happens also in other countries, rarely bring up the subject of sexuality and intimacy because there are issues of personal discomfort. They don't know what to say to the patient. They lack of training in this area, or they fear, or they think that if they start a conversation, then they will be overly intrusive to the patient. And in my mind, the patient hopes that someone asks, and the doctor at the same time hopes the patient doesn't ask. I don't know if you have the picture. Imagine that you are the doctor and says, okay, please don't talk about sex. Please don't talk about sex. Don't ask something. And the patient thinks, oh God, please ask me about my sex life. Ask me if I have some symptoms. Tell me what to do. And they don't communicate. They don't communicate. But you know what happens? We have solutions, and we have trained professionals, physical medical doctors that are doing the job. Okay, we have also rehabilitation programs about sexuality in chronic diseases. And nowadays we start talking about all these things, not only here in Greece, but in other countries. And we have a great opportunity of using the Plicit model. You know the Plicit model? The acronym of the Plicit model?
Maybe you can explain it briefly.
Plicit model is an acronym, is a rehabilitation program. It was developed in 1976 by Anon, a psychologist. And it's an acronym who stands for permission, limited information, specific suggestion, and intensive therapy. And it addresses all sexual issues that chronic people have.
Okay, thank you.
That's something new. Yeah.
I think it's really...
Because in our sexuality, all diseases affect us in 3 different levels: the primary, the secondary, and the tertiary level of sexuality. And with the Plicit model, we can address all these levels.
Could you expand on these levels?
What?
Could you expand a bit more on the different levels?
Yes, the primary level, the primary sexual dysfunction level, stems from the changes that are directly due to the disease. For example, if we have multiple sclerosis or Parkinson or dementia, it's from the central nervous system. Okay, all the symptoms that we have and affect us in our sexual function. Like if we are talking about men, we're talking about erectile dysfunction. Or if we're having a female patient, we're talking about loss of lubrication. vaginal lubrication. We have the secondary causes of sexual problems, which is fatigue, weaknesses, maybe spasticity, lack of coordination, tremor, bowel and bladder problems, pain, sensory issues, mobility issues, cognition, problems from cognition. And the tertiary sexual problems are the psychosocial problems. Meaning the results from psychosocial and cultural issues that can interfere with sexual feelings and sexual response, like depression, performance anxiety, changes in family roles, our self-esteem, our body image concerns, loss of confidence, internalized beliefs and expectations of what it means for someone to be a sexual man or a sexual woman while having their disease, or maybe a disability from their disease. And all these things can be addressed through specific suggestions and and we have a lot of solutions for this kind of problems.
That sounds
I
very
said it
interesting.
in one breath, okay. I don't want to take all the time.
Yeah, maybe we can talk about that a bit more later, but I think Irene also wanted to say something on this.
Yeah, I love this because it's hard to talk about sex, but the patient is thinking that, but the doctor, she said it already, they're also thinking about it because a lot of doctors are afraid to talk about it. And I think this is now changing. The World Health Organization also said the sexual life is for everyone. So I think the doctors are in duty to do it, to talk about it. And I think it's upcoming that doctors are doing it more, but they have to be a little bit trained, and sometimes they have a little bit to shock to a patient that it's necessary to talk about it, and not only to talk about it, but also have knowledge of what are the problems for your patients. We don't know what are the problems for the patient. I work with children, but also from the age of 12, we have to give them information. And if they don't have self-confidence about their body, they can have problems with sexual life, and we have to talk about it. But the doctors, children doctors, don't know that they are in that stage that they have to talk about it. So I think the doctors need a little bit more education about this subject. And I think patients always have to talk about it, because then the doctors also see that it's necessary that they have to talk about it. And it's not only going about the disease, but it's going on quality of life. And for a quality of life, you need also a sexual life. In what senses you can have it. So both patients, and sometimes it's scared because it's a taboo, but everyone wants sex, or the most of people want sex. So why is it taboo? It's a normal topic, like peeing and have stool. There are taboos, but everyone does it. So think about that when you have to talk to the doctor. Also, he is born, so his parents had sex. Maybe the doctor has also sex, so it's a normal topic.
Yeah. And we're trying to take the stigma of this, but it can be very hard to do so. So I think concrete actions to move away from the stigma need to be in place.
But maybe it's nice to hear that sometimes the doctor is calling me, "Oh, Irene, help, there's someone with a problem on this topic. Please come to help me," because they are also insecure. They are 15 years in college. And if the patients have erectile dysfunction, they call me and they say, "Oh, Irene, help." And they don't want to talk about it. So we have to do it and know that the doctor, some doctor will find it a little bit scared, but only if we are moving back to the taboo and go it away and think everyone wants sex or have sex, or if you want, we are going to talk about it. So let's go for it.
Yeah. Moira, maybe you can explain a bit like how we can get doctors away from that taboo.
Well, it's not only the doctors that they have this taboo. the whole society that has still this kind of taboos. And a great role in this direction was done also by the social representations. Okay, we the psychologists have played a very bad role in that. Okay, may I remind you the movement of eugenics? I don't know if you know about that.
Oh, please explain.
The movement of eugenics was, if I'm not mistaken, I don't know if I'm making any mistake now, in the United States during last century, that they believed that everyone who has a chronic condition should not have children, so they sterilized a lot of chronic and disabled people. Okay, and we, the psychologists, played a very bad role in that. And afterwards, the social representations of our society was that, okay, chronically ill are not sexual beings. They don't, they ought not to pass anything to the next generation. So, okay, they don't need to have sex. So it's not only the doctors. Many members of our societies, unfortunately, have these taboos. And when we are talking about children, because I heard that someone works with children, I'm very glad with that. Most of the parents don't want their children to know. Am I right? Is it the same also in your countries? Because in Greece, a lot of parents don't want their children to know about sex when they have a chronic condition, because they believe that they are going to be hurt if they are, because they are going to be rejected from possible partners when they will go in their teens. And they say to us, don't talk about sex because she or he is not going to have sex because of his or her condition. So don't talk about it.
Yeah.
We have this kind of problems here in Greece, unfortunately. And I'm not talking about people that having problems like diabetes or maybe thyroid hormones disturbed, but other chronic conditions like cerebral palsy, autism, developmental disabilities, mental illnesses, which are very common in the population nowadays.
Yeah. Yeah, I would like to invite everyone, all the participants, if you feel comfortable sharing maybe how it is in your country or what you've experienced, feel free to raise your hand, like Anastasia, I think is. Maybe you would like to talk about it?
Yeah. So something that I could add as well, I guess someone that comes from the side of education and what's done in schools and in education, even there, it's still a very much taboo topic and one that isn't spoken about. Like we've had, like, so I'm 23, so when I was 18, 19, 17, even in school, the group of students in the year above us had sex health or sex education, etc. The class below us had sex health and education, but for some reason, like, our class missed out. We got like maybe one session during Healthy Living Week, which was great, but it just so happened that they either missed out our year or it wasn't made as much of a priority. I'm not sure, but even in the curriculum, it's just something that we have to tick off and not something that really is part of the system. Why are we teaching it? What's the importance of it? How does it make up a human, holistically, and the importance of it? So going back to that as well, it's, well, where does it actually lie? Where are we making room to talk about it? Because if it's not said by the doctors, it's not said by the parents, it's not even quote unquote forced in a school, well, then where is the conversation, really happening? And also, as someone that's also a patient, if you've had the same doctor since you were very, very young and they've known you all your life as well, I think often it's still hard to have that conversation because they probably still view you as you were when they first met you, when you were either a newborn or maybe 5, or because they're so specialized in your condition, which is great, I think they forget that transitional side of it as well. So I don't know if that's something that makes it more hard, but I think it's about time that we're done with these excuses of why we're not doing it. Let's see what we can do to have them. And, so that's just my side of it.
I think, yeah, that's really great insights. I see also that Bianca raised her hand.
Yes, thank you. Sorry, I don't have a camera on my laptop, so sorry for not seeing me. In my condition, I have endometriosis, and one of the leading symptom is painful sexual intercourse. So it's a big deal here to talk about sex, and the thing is that if you go to like a normal gynecologist who is like not a specialist in this area, you can talk about your experiences like having painful sex. They don't really know it's a symptom. They just say like switch positions, or it happens sometimes, maybe get a new partner. So it's really difficult if you have like several doctors who tell you that it's normal that you are having painful sex, and after time you go to someone who is really a specialist in this field, and you may not mention this symptom because like other doctors said it's okay. So I think it's hard to know which is like a symptom when you have to talk about your experiences, sexual experiences, and who you can talk with.
Yeah. Maybe we can circle back. So we've talked a lot about healthcare providers, but what is also like with other people, you like potential sex partners? How is talking about your condition there? Maybe Konstantina, you can come back to this.
Yes, my experience, because
you feel comfortable.
I'm comfortable sharing and saying whatever it might need. If I don't feel well right then for my disease, then I will say directly, and I have to say it beforehand so they know, not in the middle of the action. So I'm very comfortable, but I know a lot of people that they're not, and they hide it, and they might have like a hypocrisis, which is very low situation, which is very bad and very critical for their health. And they don't want to share it with their partner because they feel that they will be discriminated. So although it's not a big deal, but I don't believe that this comes for the sex action. It's something from the society. They feel that they're discriminating them the whole life, so they feel that their partner will be discriminating too. And yeah, it has a lot of angles, but this is my experience with some other people that I've talked with.
Thank you for sharing.
I think it's good to know that a lot of people are finding it really hard to talk with a partner or friends talking about sex. I think it's not only if you have a disease. A lot of young people find it really hard to talk about sexual life, and you see a lot of Facebook and YouTube and TikTok movies about a whole other world of sexuality, and the ideal things are so high. So I think on this moment you have a lot of self-confidence nodig and necessary to talk about it. So you have to know for yourself who you are and that you are have your self-image ready, and then it's easier to talk about it. But a lot of people, and not only with a disease, have the problem that they found it really scary to talk about sex with friends, but also with their partners.
Yeah, thank you. Okay, we're running a bit low on time, so we should go to the last topic. Treatment plans should consider sexual and reproductive health. So this could be also during clinical development, but also any medication. Should you give, for example, women in reproductive age a treatment that could influence their reproductive health?
I think this has to be the choice of the patient again, because not all women in reproductive age want to have children. So a lot of doctors might force them to have this treatment, although another one might be better for their health. I had a specific discussion with someone, that's why I'm sharing this specific thinking. But some treatments for the affects the sex life in general, the libido or the dryness, and if the doctor show all the after effects of the treatment, then it's the patient's choice. What do they need more? Like they want to have a sex life with no difficulties, or do they want a treatment that might not affect this? And if they want to get pregnant, then they should change the treatment. And if they don't want to get pregnant, then it's not the doctor's choice to force them to have the specific treatment because they are in reproductive age.
Mm-hmm.
I agree with that.
Yeah.
Oh, sorry. Sorry.
No, continue, please.
I agree with that. Every doctor should discuss with the patient whatever he or she wants to do about the treatment and how they balance the contradictions regarding sexual function or reproductivity against the side effects or maybe the cost of the treatment for the quality of life, because a lot of medications have contraindications with getting pregnant or leaving your partner pregnant, and I don't know, some other things are maybe lower the libido, like SSRIs when you have a depression or something like that. But we have to balance the risks and the benefits. But it's up to the patient to do this balance, not up to the doctor.
I totally agree.
Okay. So you don't think that some women in reproductive age should not get certain treatments because they could get pregnant?
They should know about this side effect or this danger, and they should take the risk on their own. For example, in multiple sclerosis, which is an area that I know best of all, when we have a patient that takes the diagnosis of multiple sclerosis and needs to take treatment, and this is a woman on reproductive age, we discuss with them, and we're telling them that, okay, you need to take a medication. These medications contradict with pregnancy, so think about it and tell us what you want to do. And we leave the lady to take the risk. We don't force anyone to take a drug that it is very harmful for her or the baby.
Mm-hmm.
We discuss different options.
Yeah. Bianca raised her hand again.
Yes, because sometimes it's like neither's choice, because like some procedures are just not legal to do like in a certain age. Like in our cases, hysterectomy can be a solution for lots of things, but it's illegal to do it on girls with really young age. Just after a certain age, after having children. So what I see is sometimes not even the doctor has choice to have with patient.
But this comes again in the thinking that all girls in reproductive age should not affect the uterus. So if this changes in people's mind and in the member of the parliament, I don't know, whoever, policy makers, then they should change this, because if a woman who is young and wants to do hysterectomy, then she can choose to do it if she doesn't want children. Although she should know beforehand that she will not be able to have children if she changes her mind in 10 years, which has to be her own choice.
Yeah, but
it's a hard choice, huh?
It's a
very
hard
hard
choice, and sometimes they just don't let them choose. Also, there are like lots of treatments that can cause infertility, and if it happens in like a young age, but in a reproductive age, like around 16, can we offer young ladies the choice that get like IVF treatment and get the eggs frozen so they can use it afterwards. I think it's a really deep topic that we are discussing here now.
Irene, would you like to also comment on this?
Yeah, it's a hard one. I think again, you have to give a lot of information to the patient, but the patient is alive and he wants the way he wants to live. So I think the medical people have to give a lot of information and offer someone to talk about it, because if you don't want to have children when you are 20, you have to talk with someone. If you are sure, if you're doing something and you can never have children again, then it has to be a good choice. And I think a psychologist or someone else can help you to see the consequences. Sometimes the social network can do it, and sometimes the social network not enough. So then you have to give someone to talk about it and give some time. Don't say it, I want to hear it tomorrow, what you said, but give the time and come back on it. And do it, I think the important thing is do it together. Talk about it and give choices.
Great. Thank you. Are there any questions from the participants? No?
Maybe not only for this topic, but for all of them. You can still write them in the chat. Meanwhile, I can ask you one thing that I had on my mind, which is kind of related to the second topic. So the term patient is a very broad one and can be STD or cannot be or not. But sometimes, even though it is not transmittable, it is treated as such, or at least it is, the first thought is like, it's transmittable, so nope. How can someone deal with such situation, or how can we overcome this? to prevent it. I guess prevent is the better.
So you mean the fear of catching on, like
Yeah.
condition? Yeah. Yeah. Do the panelists have experience with this? Talking about this, maybe also in general
Well,
yeah,
I think
narrative that chronic
this
people
lack of awareness in the diseases and in the specific disease. So if you talk about it with the partner and have an open discussion and show them that for you it's nothing, generally it's not a big deal. So it shouldn't be a big deal for the partner too. Whatever, in my experience, whatever you show to the other person, then this is what they get on afterwards. So if you are afraid to talk about it, and if you are afraid to share your thoughts, then they will be afraid to ask, and they will be afraid to, generally afraid.
Yeah.
But if you have an open discussion and you're cool with it, then they will be cool with it too. They don't have another choice. They shouldn't have. And if they're not, then they're not worthy. So
great attitude.
Can you repeat for me the question one time? Sorry, I didn't hear it very good.
It was just about that the fact that patient is a very broad term and can be sexually transmitted disease or not, and sometimes is treated in the wrong way. I mean, even if it is a sexually transmitted disease, it also has to, of course, especially for this, has to be a discussion before the act. Like for, I'm thinking for the HIV patients, it is transmittable, but if it's treated, it's not transmittable. So the discussion needs to happen.
yeah.
But the idea is, how do we like overcome this stigma that the patient term means that?
The stigma generally, or in your partner specifically? Because generally it's, you should advocate to fight this, but it's not something that will happen in one day or 1 week. And it's something that you should do it alongside other patients too, and other advocates. But to your partner, then it's your job to raise awareness. It's your job to show them that even in HIV, that if I treat it, then it's not transmittable. So you shouldn't be afraid, or you shouldn't care about it when I'm not.
Yeah.
You know, which is sexually transmitted nowadays, and it's very, no one talks about it. Let me give you a hint. COVID-19 is transmitted via sex. No one talks about it.
Via sex or via kissing when you have sex?
No. When we exchange our fluids.
Yeah.
Just think about it. And we know that most men that have passed the COVID-19 disease have problems in their semen afterwards. It stays in their semen. We have studies about that. So it's an, how can I say, Konstantina, help me.
STD.
Yes, an STD virus then. And no one talks. What is happening when you are in the LGBT community and you have COVID-19? Think about it. It's not only the HIV or maybe other diseases. It's something more common and more spreadable. It's very hard to have sex with someone who has an STD disease. It's very hard. It's very hard to feel secure. because you have to be very aware of who is the other, that he or she is not going to put you in danger, or maybe she is not going, or he is not going to put in danger themselves. Okay.
I think it's important to point out that HIV is not transmitted through like COVID, that is different, like other routes. So
HIV, it's more secure than COVID. That's why I gave the example. But when we meet someone and says that, oh, I have HIV, we feel, oh, don't kiss me, because maybe we're afraid. But if someone says, I had COVID-19 6 months ago, so, okay, no problem. But it's more easy to catch something from COVID rather from HIV.
Yeah,
We need to know about that.
also because HIV is not transmitted through kissing.
Yeah, but COVID is. And not only kissing, I have to say that.
Well, I think if you have problems with the sexual transmitted, then the health system, they know that they have to talk about sexual life. And it's a hard issue. It's a really hard issue with a lot of problems. But I think the main part is when you don't have something sexual transmitted, you have something totally different. Nobody thinks about it, that you can have problems with your sexual life because you have diabetes or problem with your kidney, why it affects your sexual life. I think if you have some disease that you have sexual transmitted, you can do it, then there is awareness and people are going to talk about it, and it's very necessary that they talk about it. But it's also necessary for other disease that we talk about this topic.
And of course, if someone has an STD like herpes, they should treat it first and then have sex. It's their own personal thing to think about. They shouldn't like transmit it.
They ought to do that.
That's true. Yeah. That's true. It's a personal responsibility.
Yeah.
Okay, we have to come to an end, but it was very great discussion. I think we explored many different areas. I understand that there are not so many questions from participants. It is a difficult topic that is still very stigmatized, but I'm very, very grateful for your participation and especially for our panelists. You did really good. I really enjoyed this discussion. And I hope we will, even though our project comes to an end, we will continue to talk about sexual health and well-being.